What really happens when you feel breathless during exercise? Is the limit coming from your lungs, your heart, your circulation, your muscles, or simply deconditioning? A cardiopulmonary exercise test, usually called CPET, helps clinicians investigate that question by watching the whole oxygen transport system work under controlled stress. It is more than a fitness test and more comprehensive than a standard cardiac stress test. Break time zero point 0.6. At rest, heart and lung tests can look reassuring even when symptoms appear during activity. CPE changes the context. As exercise gradually becomes harder, it measures how much oxygen you take in, how much carbon dioxide you breathe out, how fast and deeply you breathe, and how your heart rate, rhythm, blood pressure, and oxygen saturation respond. In other words, it follows the journey of oxygen from the air, through the lungs and bloodstream to the working muscles. Break time 0.6. A clinician may request CPEE for unexplained shortness of breath, unusual fatigue, or reduced exercise tolerance. It can help describe the severity of heart or lung disease, guide rehabilitation or an exercise prescription, evaluate response to treatment, and estimate risk before some major operations. In selected patients, it also contributes to decisions about advanced heart failure care. The test does not replace clinical judgment. It adds a detailed physiological picture to symptoms, examination, and other investigations. Break time 0.6. Most tests use a stationary cycle, although some laboratories use a treadmill. Before exercise, staff review your health, explain the procedure, and collect resting measurements. Small adhesive electrodes record an ECG, a cuff measures blood pressure, and a finger, ear, or forehead sensor tracks oxygen saturation. You then wear a closely fitted mask or mouthpiece connected to a flow sensor. This measures every breath and samples oxygen and carbon dioxide. Some specialist tests also include blood samples, but that is not routine everywhere. Break time 0.6. The active test follows a simple pattern: rest, warm-up, increasing work, then recovery. On a bike, the resistance rises steadily while you maintain a target pedaling speed. On a treadmill, speed or incline may increase. The exercise phase is commonly designed to last about 8 to 12 minutes. It should feel progressively challenging because the goal is to observe your best safe effort. You can signal a problem at any time, and the clinical team watches you continuously. Break time 0.6. What does the test reveal? One headline value is peak VO2, the highest rate at which your body uses oxygen near maximum effort. It reflects the combined performance of lungs, heart, blood flow, and muscles, so it is not a score for one organ alone. The report also examines the ventilatory threshold, the point where breathing begins to rise more sharply as exercise intensity increases. This can help describe sustainable exercise capacity and guide training zones in the right clinical setting. Break time 0.66. Clinicians also study patterns rather than one number. The relationship between ventilation and carbon dioxide gives information about breathing efficiency. Oxygen pulse is a calculated value influenced by how much blood the heart pumps with each beat and how well tissues extract oxygen. Breathing reserve helps show whether the ventilatory system approached its maximum capacity. Heart rhythm, blood pressure, symptoms, oxygen saturation, and the reason the test stopped all matter. Interpretation uses the full pattern, along with age, sex, body size, medical history, and the quality of effort. Break time 0.6. Preparation instructions differ between laboratories, so follow the directions on your appointment letter. Common advice is to wear comfortable exercise clothing and secure shoes, avoid a heavy meal for at least a couple of hours, and avoid strenuous exercise on the day. Many centers ask you to avoid smoking or vaping and may limit caffeine before the test. Bring a medication list. Continue or withhold medicines only as your own clinical team instructs, because inhaler and medication guidance can vary depending on the purpose of the test. Break time 0.6 as CPET is performed by trained staff with monitoring and emergency procedures in place. Feeling breathless, tired, or having heavy legs is expected as the workload rises. Tell the team immediately about chest pain, dizziness, faintness, unusual wheeze, or any symptom that concerns you. Testing may not be suitable during an acute illness, after a recent heart attack, or when certain heart rhythms, blood pressure problems, oxygen levels, or other conditions are not adequately controlled. The supervising team screens for these issues before exercise. Break time 0.6. After the peak effort, you continue gently for a cool down while monitoring continues. The data are reviewed together, often across multiple graphs, so results may not be immediate. A report can help your clinician decide whether limitation appears mainly cardiovascular, ventilatory, related to gas exchange, muscular, or deconditioning, or whether the response is broadly normal. No single graph should be interpreted in isolation. If CPPET has been recommended for you, ask why it is being done, how to prepare, and when the results will be discussed. The value of the test is not just how hard you can exercise. It is how your entire body responds when exercise asks every system to work together.